Welcome to Powering Through Life on the Deepest That Care Network. I'm your host, Teresa Sims, and I'm a transformational life coach, an award-winning author, and a multiple #1 best-selling co-author. Each week on Powering Through Life, my guests and I will discuss a special topic that is close to their heart. Together we will explore the challenges they have faced in life and learn what strategies and tools they have used to power through their lives. So welcome to Powering Through Life.
I have a wonderful guest today, David Hastings Lloyd. And David is a traditional Chinese medicine practitioner and a doctor of acupuncture who has been in practice for nearly 20 years. He has taught the modern pharmacology of Chinese herbal medicine in China, and as well, he is the author of several books. And I'm really going to find this topic fascinating today. So David wants to talk to us about women's health issues regarding PMS. So David, welcome to Powering Through Life.
Oh, thank you very much for having me.
We lost you there for a second, David.
Oh, you did?
Yeah.
We tried to avoid that.
Yeah.
But thank you very much for having me. Can you hear me now?
Yes, I can hear you now. This is perfect.
Okay.
So this is a fascinating topic, women's health issues regarding PMS. Now, why do you find this area of practice so fascinating?
Partly because I had two older sisters. And so I was around, I had a very a female-centric house. So I really genuinely do care about the things that negatively impact women's health. I also find that there are gaps in the conventional medical model, and that's kind of a big part of my job, is filling in gaps in areas in modern medicine, and so or what's typically called allopathic medicine. So my job is kind of to fill in those gaps, and the conventional medical system, with the exception of birth control, doesn't usually have a lot of ways of dealing with the problem. So I wind up getting a lot of patients that have trouble with PMS.
Okay. And why are there gaps in the allopathic medicine?
That's a good question. To be honest with you, I think it's just that's just the way that it is. I think in a lot of cases there isn't a specific reason for it. It's just they have a treatment that a lot of people are happy to take, so they don't really expand on it because there's a situation, I guess, that's happening right now where I'm dealing with a lot of patients that don't want to be on birth control because they want to get pregnant. Mm-hmm. And so in the process of them wanting to get pregnant, they won't take birth control. So I think that plays a pretty big role in this situation, that the conventional medical system does have a treatment for it, and they don't really want to expand a lot on the treatment that they've already got.
Okay.
So it just sort of it leads to a little bit of a gap in I guess in that area of practice.
Okay. So I understand that, in surrounding all of this, that stress can play a really important part in our hormone levels, and it
does. Yeah.
Yeah. So could you explain that a little bit for us?
Yep. No problem. So one of the things that I guess I'll start by saying this. So because PMS is kind of a mystery to some people, they just know that they experience it and they don't know why. So I guess one of the major drivers of PMS, and I guess before I get started on all the scientific stuff, I always like to start things off in these types of conversations by saying that the evidence base is always growing. Mm-hmm. So there may be new things that come up that aren't covered in this conversation. So I'm going with what I know currently, and things may change in the future, but I'm going with what I know currently. So
perfect.
What happens with PMS in terms of what causes it to manifest is that it's fluctuations in hormone levels, in particular estrogen and progesterone, and they drop, they decline right after ovulation. Now, ovulation is when an egg is released by one of the ovaries, and ovulation occurs kind of midway through your menstrual cycle. So what happens right after that is that estrogen and progesterone have a tendency to drop. And that's what will drive a lot of the symptoms that you get in regard to PMS. So symptoms of PMS issues can include things like hormonal acne, lower back, abdominal pain, headaches, breast distension, fatigue, and sleep problems. And I guess probably the most famous symptom related to PMS is changes in your mood. And if we get the chance to talk about it toward the end of this conversation, I'll talk a little bit about something called premenstrual dysphoric disorder, where it's sort of a more...
Sounds interesting.
It's a more significant mood alteration that happens in relationship to PMS, and it's dealable and it's treatable, so it's definitely worth discussing.
Perfect.
So that's kind of where that's where this all sort of starts off. Now, with that, the relationship between stress and PMS is pretty interesting because most people don't realize that stress and your sex hormones like estrogen, progesterone, testosterone, that kind of stuff, they're made up of the same material. So if you make a lot of stress hormone, that by itself will decrease your estrogen and progesterone level. And then if you have a further decrease after you ovulate, then you really get signs of PMS. And because they're made of the same material, most people don't really realize how big a role it'll play if you're already under a lot of stress. And so, so that's the direct connection.
That makes a lot of sense. I mean, I'm thinking back to my days, and oh my goodness, that makes total sense to what I experienced and had for years. So thank you for clearing that part up. That's awesome.
No problem. It's going to get better from here, I promise.
Oh, great. So what are the other factors that impact hormones?
There's a lot of different things that'll impact hormones, sleeping patterns, light exposure. But what I find to be probably the biggest impact factor on hormone levels is diet. Diet plays a big role because, and I think a lot of people, you say, oh, well, does your diet affect your health? Well, yeah, of course it does. But a lot of people don't realize that your hormones in general, which includes your stress hormones, but also your sex hormones, are made of cholesterol. So a lot of people following really, really, really low-fat diets, and if you just Google this, really low-fat diets, what will happen is they'll stop having a menstrual cycle altogether because they're not consuming enough cholesterol in their diet to manufacture those hormones.
Would that be why when you see athletes at the peak of their game, I guess you want to call it, that in some cases they don't have menstrual cycles because they're...
Yeah.
Oh, okay.
Yeah, absolutely. If you've got really low body fat, we're talking about females here. If you have a really low body fat, then it'll adversely affect your menstrual cycle. In fact, in a lot of cases, being significantly underweight will stop having a menstrual cycle altogether as well. So
interesting. So it's almost like the body. It's almost like the body decides, okay, if it's not getting something, it's going to give up something else in order to protect itself or do what it needs to do to survive.
Yeah. When it comes to the certain types of environmental pressures, your body just kind of responds by saying, well, if the environment isn't plenty enough in terms of certain macronutrients like fat, it'll say, well, it's going to be dangerous if I get pregnant like this, right?
Oh,
so
makes sense.
Because and this goes for restricting a lot of areas in terms of diet, but sort of the most famous area in regard to PMS and menstrual cycles is dietary fat and really low body fat percentages.
Interesting. Now, I heard you mention light exposure. Could you explain that one for me, please?
Sort of. It's not an area of expertise for me. I know that we operate in sort of a natural rhythm, where in the morning we're supposed to be exposed to certain types of light, and then later in the day we're not. And there are rhythms that are driven by these areas in your brain, like your pineal or pineal gland and your hypothalamus and these types of things. And this natural rhythm that we're supposed to have is that we're supposed to have a boost in stress hormones first thing in the morning, and that's what causes you to wake up. Mm-hmm. So, if you don't get those light exposures in that natural rhythm, quite often it'll alter your hormone levels. Like you'll get a burst of stress hormone in the middle of the night as opposed to it happening when the sun comes up type of thing.
Okay.
And that's what causes people to wake up. That's why sleep problems are associated with PMS, because your body's not making as much estrogen or progesterone. And as a result of that, your body will start releasing stress hormones during the middle of the night, and then that causes you to wake up. And the better that you can have that rhythm set to what it's designed to have, the better your hormonal health is going to be. I'm not an expert in circadian rhythms, but that in a rough way I think would explain that. Yeah.
So how does that affect women who are doing shift work, like different shifts, alternating shifts?
Yeah, I don't like to be the bearer of bad news generally.
Okay.
So there's a lot of research on shift work and its negative impact on people's health. I also love society, and I understand that shift work is it's a part of how we run society. So, I don't disrespect the idea that people do shift work. It's just, it does come with health consequences.
Right.
Because, light exposure, like normal light exposure, not fluorescent lights,
right.
Light exposure is highly associated with vitamin. Well, it's directly related to vitamin D, and most people think of vitamin D as a vitamin, but it's actually a hormone. So, so light exposure plays a big role there, and vitamin D is really closely related with your sex hormones because, again, they're still sort of part of that same chain.
Well, I learned something interesting today. That was fascinating. I did not know that. Thank you.
I'll keep them coming.
Thank you. That's great. Oh my goodness, I've learned so much already. So, David, you practice Chinese herbal medicine. So, how can Chinese herbal medicine help with menstrual issues?
Well, there are many different formulas that are used for regulating menstrual problems in Chinese medicine, and it's very much based on individual diagnoses. So maybe a patient has what we would call a blood deficiency, so they have a menstrual cycle, but it's irregular, and when they do have it, they don't have very much blood, and that type of thing. And so in that case, we would tonify blood, or your liver is responsible for holding on to blood. So, if your liver gets really tied up due to stress and things like that in Chinese medicine, we would use a formula for that. Mm-hmm. Chinese medicine also has formulas for what we call kidney function. And in traditional Chinese medicine, the kidneys were tied in with the adrenal glands. And most people don't realize that a lot of the precursors to your sex hormones actually come out of your adrenal glands, which sit on top of your kidneys.
Oh.
So if you have a kidney deficiency, which would manifest itself as, lower back pain and, knee pain and that type of thing, then you would use a formula for that. It depends on how the patient presents. But I've helped a lot of people with their menstrual cycles, and I've also helped a lot of people actually conceive too, because they're related to each other.
Okay.
So,
do you want to discuss that a little bit further?
I can, but I do want to talk about premenstrual dysphoric disorder a little bit, if that's all right with you.
Absolutely. Let's do it.
Okay. So, as an extension of PMS is sort of I guess maybe it's not an extension, but an associated diagnosis is something called PMDD, premenstrual dysphoric disorder. And premenstrual dysphoric disorder is there's a lot of technical aspects to how stress negatively impacts your neurotransmitters in your brain. But one of the things that happens when your stress hormone levels get really high is it causes a major decrease in something called serotonin.
Mm-hmm.
And serotonin, people think of serotonin and they think, serotonin is used as an antidepressant. And so just naturally, by the way that we discuss these things, we think serotonin and then we think happy or, something to that effect.
The feel-good hormone, right?
Kind of, but not so much. The big thing with serotonin is actually that it's involved in status.
Oh.
So if you have really, really low serotonin levels, you won't feel like you're worth a lot, and it'll make you feel really, sad. But not sad in the sense of a lack of excitement. Sad in the sense of you just won't feel satisfied, you won't feel safe. You'll feel like you're lower in status. Mm. And serotonin is really strongly associated with that. And that's how a lot of antidepressant medications work, is that they'll regulate levels of serotonin.
Right.
And PMDD is really strongly associated with lower levels of serotonin, and it can be really problematic for some women because, when you think about how much time, and I've dealt with this with patients where they'll say to me, when you fix the problem, they really notice it because they'll spend 3 or 4 days a month, which is, 10+% of their life. And they're either really depressed or they're in pain or, they've got abdominal pain or lower back pain or, mood instability, and they don't feel like themselves. Mm-hmm. And PMDD is kind of an extension on that where it really negatively affects your mood.
Goodness. It sounds like it just can really adversely affect all aspects of a woman's life.
Totally. Yeah. That's why I like helping people with it, because I had somebody tell me that I gave them 10% of their life back, and that was kind of the big eye opener for me as a guy. I never really thought about it that way. And 10% is a lot of somebody's lifetime, right?
It absolutely is.
It changes because eventually you don't have to worry about it anymore. But for half of your lifetime, 10% of half of your lifetime is a lot of time, right? So
exactly.
Yeah.
Well, then you go from PMS, then you go into menopause, which can, destroy all aspects of your life as well.
The interesting thing is it's the same mechanism. It's the same pathway.
Is that right?
What happens is, as your estrogen and progesterone level drops, your stress hormone levels go way up because they're made of the same stuff. It stimulates your sympathetic nervous system, which is your fight or flight nervous system, and that's what causes you to have all those problems, heart palpitations, sweating. It's like getting a huge shot of a corticosteroid.
Yeah.
And so, the agitation and, your sympathetic nervous system gets overstimulated. It plays a big role.
And it's not pleasant.
No, I deal with it at work. When I was in medical school, I did induce a hot flash on myself.
I found that fascinating. You know what? But I highly respect that as a female, having a male doctor. I do highly respect that you've done that because you have an understanding that most men don't now.
What's really funny? The reason why I did it was because nobody ever called me when I could fix a problem, but they sure called me if I could get rid of their hot flashes. And it was honestly, it was a real eye opener. I thought, oh wow, I fixed somebody's migraine or something, and they don't call me and say, wow, you fixed my migraine. But if I could get rid of somebody's hot flashes, they were like, thanks for fixing my hot flash.
So do you want to tell us how you did it?
I took a really, I took a fairly high dose of a flush form of a B vitamin. So it wasn't anything dangerous or anything like that, but I induced a full-on, I induced a full-on hot flash, and it was super uncomfortable.
I can imagine.
I
do know how it feels, but yeah.
Yeah, one of my profs told me how to do it, so it was just like, oh, okay, well, I'll give that a try. It's definitely not dangerous, and so yeah. And,
but it opened up a whole new world for you to be able to understand what your clients, your patients are facing and dealing with.
Yeah.
I salute you for that one.
Well, there was kind of a funny rabbit hole that it took me on, too, because it was like, once I had learned about this pathway related to these sort of vasomotor symptoms, then all of a sudden I was studying the impact on hormones and aging and just all these other things that I otherwise never would have bothered with if I hadn't been like, what was that all about? Right? And nothing sends you to the books with a medical problem faster than experiencing it for yourself.
I can imagine.
Yeah.
But there's lots of studying. I can imagine that you could do further on it, and I'm sure you are, because it's one of the main things that you face every day. So with your patients. So, what else can a woman do for her menstrual issues and her hormones?
The biggest thing, honestly, is making sure that they're getting quality food. And when I say quality food, I mean like the stuff that your body would recognize as food. Making sure that they get enough dietary fats and making sure that they get enough of the right types of vitamins to convert those fats into the hormones that they need, which generally revolves around, for the most part, B vitamins. So, that's the biggest thing. That and having it's interesting. That and having a regular cycle, like a regular behavioral cycle, normal sleep patterns. Your menstrual cycle like anything else, right? So if everything else is out of whack in terms of your rhythms in life, then you'll get yourself into trouble that way in terms of being dysregulated in other ways.
Mm-hmm. So added things like exercise and maintaining stress levels, keeping them low, all those sorts of things. Meditation's really good for keeping calm, all those other aspects that we sometimes push to the wayside but are really, really important that we incorporate into our lives, right?
Yeah, for sure.
Excellent. Okay, so is there a favorite quote or a saying that you like to use? Would you like to share?
I have one from when I was younger, and it kind of has a neat history. It's actually a Bruce Lee quote. It's from one of the movies that he was involved in. You'll never step on the same piece of water twice. And I guess the reason why I like that is, especially when it comes to medicine, patients, we all have the same bodies, and we all have the same organs. We all have the same systems, but people will present differently. And I remember hearing that from a clinical prof. Him talking about just the individual nature of the way that the human body will present itself. Everybody has very similar hardware, but the way that their illness will express itself will be different. And so when you say, you'll never step on the same piece of water twice, it's very similar with patients. You'll get that too in terms of interactions with people and patients. My dog is barking in the background. Sorry.
No, can't hear anything.
Okay, good. You'll see that with just the individual nature of the way that people will, how to get in the flow with them as a patient. You really have to pay attention on an individual level.
That's true.
With people, yeah,
because we're all different personalities, but we all have the same, like you say, the same chemical makeup, the same body, all that sort of thing. It's all the same, but we're individuals, and we all have our different ways. So, and as a patient of yours, I can say that you do an exceptional job of
thank you.
Really getting to the core of what's going on and getting to know your clients and your patients, what their histories are, what they're dealing with, and having great conversations with them. And that brings it all down from a high medical standpoint down to we're equals talking and having a conversation about how I'm feeling, which I appreciate so much.
Well, I'm thank you. Thank you. I really love what I do. I've always wanted to do what I do for a living. It's been 28 years this year that I've wanted to do what I do, and I've been practicing for a long time. So, I appreciate hearing that. Thank you.
Well, you're welcome, and congratulations on the 20-plus years. That's fantastic. Keep going, David, because you're doing something right. You're helping women with issues that, number one, sometimes we're afraid to talk about. You can't always go to your male doctor because they don't get it, they don't understand, and they don't always want to hear it. And they just shove other things on you to Band-Aid, not all, but some. You're having trouble with this, your moods are bad, so we'll give you, like you say, the antidepressant. Well, that's not always what's necessary to fix the problem. So listening to
sometimes it is.
Yes.
Sometimes it is, but again, it comes back to that individual basis where you really have to be paying attention to what people are telling you when you're dealing with them. And sometimes those things are excellent for people, and then sometimes they just don't cover all the bases to fix the problem.
Yeah, exactly. So, David, if someone wanted to get in touch with you, how would they go about doing that?
Okay. I have a blog that I keep, and this is all one word, like THE, The Meditating Man. So it's themeditatingman.com, or you can go on Facebook. I think I've got around 50,000 people on my Facebook page. And again, that's just The Meditating Man. I'm really trying to grow my Instagram, and it's small right now, but that's at The Meditating Man. That's my Instagram page. And those are really the best ways to try and get a hold of me.
Okay. And I know when I post your segment, we will have all the links to contact you there. Yeah, I think that's very important because, if anyone has any questions further, I think it's important that they contact you directly rather than going through me. However, they're welcome to contact me again as well on the segment, but I would rather that they contact you directly and ask their questions, and I hope that this generates a lot of interest for listeners and gets women thinking about, we don't always have to go with the Western medical model. Chinese medicine is fabulous as well, or in conjunction with, right? It can work together.
Oh, yeah. Yeah, integration is always the best way to go, in my opinion. But there's a lot of stuff that Chinese medicine can help with in regard to helping women's health issues. It's been around for a very, very, very long time, dealing with the same types of chronic health issues that we're dealing with in modern society. So, yeah. Absolutely.
Well, David, I really want to thank you for doing this with me today. I've learned so much, especially about B vitamins and all that sort of thing. Oh, thank you for being an incredible guest on Powering Through Life. And I hope that the listeners contact you, and we will get this shared out as soon as possible. And let's talk again soon. I'm sure there are many topics we could cover.
Yeah, absolutely, and thank you very much for having me.
Oh, you're very welcome. Thank you. Take care.
Well, Divas, that brings to a close another great, inspiring interview on Powering Through Life. Thank you to my incredible guest for sharing your story with us. Divas, if you would like to connect with my guests, just go to divasthatcare.com, click on my picture at the top, that's Teresa Sims, and there you can access all of my interviews. Don't be shy, reach out if you have any questions, or simply just leave us a comment. Also, you can contact me at my website, that's teresasims.com. Thank you for listening to Powering Through Life on the Divas That Care Network.